Hi, I'm Dr. Dave Janda. Welcome back to our ongoing Operation Freedom Health series with one of the top naturopathic physicians, not just in our country but the world, Dr. Peter Glidden. It is my honor to have Peter back today. He is not only a fantastic clinician and a fantastic researcher, but also a fantastic author. I encourage you to go to his website, drglidden.com. He has written 2 books that are a foundation of our medical library in my home. They should be of yours as well. They are entitled Everybody is Sick, and I Know Why, An Attempt to Cure with Holistic Medicine, both available at drglidden.com and also amazon.com. Now, the title of today's presentation is Protect Your Health, and here's how. I want to take you back over 2 years ago, January 2020. Peter and I had launched our series about how to empower yourself, not how to empower big pharma, big insurance, big medicine like the AMA, big government, big bureaucrats, technocrats. No, our focus was on empowering you through what you could do to enhance your own health and wellness. In January 2020, as you well remember, our world was confronted with, we have to be careful, judging the platform we're on, was confronted with a pathogen, okay? And Peter and I, in January 2020, we addressed what you could do to protect yourself. 100%, very few things in life are 100%. 100% of what Peter and I spoke about, what you could do, has held the test of time over not just protecting you, but enhancing your health and wellness. And what did we speak about? We did not talk about wearing this because the size of the pathogen was like a basketball going through a hula hoop, the hula hoop being the pores in the, whatever you want to call it, face diaper, whatever we want to put it so that we don't get, right? What we did not mention that you need to cloister yourself in your home and wrap yourself in bubble wrap and just not go out for the next month, 2 months, year, 2 years. What Peter and I spoke about was enhancing your nutritional foundation, number 1. And number 2, one of the greatest and easiest ways to get infected from a pathogen, no matter what that pathogen might be, is your own hands bringing the pathogen to your eyes, to your mouth, to your nose. And we talked about hand sanitizers, but hand sanitizers are not all the same. So let's refresh what you should still be doing today and for the years to come to protect yourself from any pathogen. And the first is enhancing your own body's immune system to protect yourself. It's my honor to welcome back my friend, Dr. Peter Glidden. Pete, welcome back to the Operation Freedom Health platform.
It's always a pleasure, Dave. Thanks for the glowing introduction.
Well, and thanks for all you do, Pete, because you take a lot of heat, as do I, for putting this series forward. Big pharma, big medicine, big insurance, big government, the Faucis of the world are not pleased that we are talking about ways in which our viewers can enhance and empower themselves to protect themselves from the health standpoint, as opposed to, oh, just take this pill or just take this, and guess what? Oh, you're just fine.
Yeah, Vimeo censored me in March of 2020.
Yeah, it's across every platform, Pete.
Across every platform. And you know, the thing about it is, Dave, that back then we were saying, look, this is really not rocket science.
Right.
If you're going to go out into cold weather, probably not a good idea to do that in your bathing suit.
Right.
Probably need to bundle up.
Mm-hmm.
Bundle up, you can sleep on the ice if you want to, if you take the proper precautions. Well, it's the same when you are exposed to a pathogen of whatever type it is. It's always a good idea to strengthen the body to protect yourself against that particular stress. And this is something that conventional medical doctors are just not taught how to support and promote your own police department of your body, which is, in this metaphor, your immune system. But which, interestingly, is why people who have who get acquired immunodeficiency disease, AIDS, that's why they die. It's because their immune system is so weak,
can't fight,
that the stuff that you and I fight off without even knowing we're fighting it off, that kills them. So the strength of the immune system is really super important. And there are ways that you can weaken it, and there are ways that you can strengthen it. And by the way, I'm happy to report that as of today, I'm a board member of a professional organization of naturopathic physicians. And we have 230 something members. None of our patients have died from the pathogen that's in the news, even those patients with really bad comorbidities. Why? Because this type of medicine is really good at dealing with that type of stress, both in a prevention and a treatment methodology. So, in base 10 mathematics, 2 + 2 = 4 all the time. Even if you don't know what mathematics is. In Cro-Magnon days, 2 + 2 = 4, even though they didn't know what math was. Natural law is what natural law is, and it's inviolate, it's immutable, and it doesn't change. This from the Department of Redundancy Department.
So let's talk about one of the fallacies, Pete, and this is a fallacy that was endemic in not just where I went to medical school, but all medical schools that are involved in individuals called, well, if you will, allopathic medicine, MDs, of which I am. We were essentially told that from a nutritional standpoint, there's really nothing you can really do to protect yourself from these pathogens. And nothing actually could be further from the truth. Educate our listeners because this, again, takes us back to January 2020, and I believe the people who listened to us and then took the appropriate steps that we spoke about truly gave themselves the best possible protection for every pathogen they might have encountered 2+ years down the road. So educate our listeners, Pete, of what people should be doing to enhance their own immune system for protection.
So you have to feed it. You have to strengthen it. I mean, if the cops show up at a crime scene, an active crime scene, and they've got guns, but they don't have any bullets, well, that's not going to go so well, right? I mean, if they jump in the car and the car doesn't go, that's not going to go so well. So you have to have, your body needs nutrients needs bullets, right, in this metaphor, in order to be strong and do its job. You're a police department. You have a police department. It's called the immune system. It needs help. You can strengthen it. And the easiest way to strengthen it is with taking the 90 essential nutrients, which are found in the Foundation Pack. Because in the human body, everything's connected. And it's like a symphony orchestra. And, most people's 3/4 of their symphony is gone. It's not even there. The orchestra's gone. They got a couple of flute players. They got one guy on the drums, and then maybe they have a guy on the cymbals. Big deal. You need the whole orchestra there. And that's why what we do works like magic, because nobody else does this. This is holistic medical nutrition as opposed to fractionated medical nutrition. And when you give the body everything that it needs, the body responds optimally because the body has wisdom and the body knows how to do it better than you know how to do it. I mean, your body's taking care of millions of things right now, all beyond your conscious control, right?
Right.
So our whole thing is, look, rely on the wisdom of the body, give the body the raw materials that it needs, get the heck out of the way, clean your diet up. Sugar is a big bad voodoo daddy to depressing the immune system. So if you do these things, you're in a much better position. You're showing up at the gunfight with guns loaded with bullets, and that's a better proposition.
So, Pete, folks will say, well, wait a minute. I went to my doc, and my doc said, well, okay, well, you're going to take these 90 nutritional items in this foundation pack. Okay, that's great. But you're going to just pee them all out. You're just going to pee them out. You're going to have expensive urine, and it's not going to help you. Please address that, because I believe those kind of statements have harmed, and potentially led to the premature death, that particular statement, of millions of people, and that's not hyperbole.
Oh, I'm in complete, utter, and total agreement with that. I mean, my people are destroyed by lack of knowledge. And, it's funny, because the way that we've been brought up is we just believe whatever the medical doctor says no matter what. I mean, in the 50s, the medical doctors said, oh, smoking 2 cigarettes a day is a good idea, right?
Yeah, right. Oh, yeah.
And so the medical professional who has no training in any of this will tell you, oh, you're just getting expensive urine by taking those vitamins. But it's got to stop taking your vitamins before you have surgery, or your blood will be too thin and you'll bleed out. Well,
right. Well,
you can't have it both ways. They either work or they don't work, or which is it? And, yet when people hear these things from their medical doctors, we're so socialized to just genuflect at the altar of anybody with a white coat and a stethoscope. It goes right over their heads, and they just believe whatever comes out of the mouth of the doctor. It's nonsense. I mean, last time I checked, back in college when I was a beer drinker, every time I drank a bunch of beer, I peed quite a bit. But I still, caught a buzz from the alcohol because it was doing stuff while it was passing through. It's the same with nutrients, and it's academic. It's an academic fact that nutritional supplementation produces a measurable physiological effect. It's known science, and if anybody says anything to the contrary, they're just an idiot, and you should walk away from them because there's no talking to them.
The other issue I want to speak about, Pete, and you touched on this with the fractionated. Some people say, I eat a healthy diet. I eat an all organic diet. That maximizes my nutrition, so I really don't need to supplement because, well, if there's one maybe thing I'm deficient in, I'll just take some extra of that. Educate our listeners on that faulty approach.
Well, those people are going to die.
Yeah, they are. Yeah.
And they're going to die stupid. So there are 90 nutrients that the human body needs. 2/3 of those, 60 of the 90, are minerals. Things like calcium and sulfur and zinc and phosphorus and potassium. Minerals are only found in nature in the soil, right? Mm-hmm. Plants can't make minerals. Animals can't make minerals. The only way that a mineral gets into the body is if it's in the soil that the food is growing in. And the plant sucks it up, it organizes it into its structure, and then we eat the plant, we get the minerals, or the animal eats the plant, the animal gets the minerals, and then we eat the animal, and it's like that. But the problem here, and this is the single biggest problem with the health of everybody in the world, if I had to drill it down to one thing, it would be this. There is no place on God's green earth in the topsoil where all 60 minerals exist. That does not happen. Maybe it did in the Garden of Eden. I don't know. I wasn't there. But in the modern day, there's no place where all 60 minerals exist in the topsoil. And farmers aren't educated about this. And in the 1930s, there was a report given to Congress by the United States Department of Agriculture. It said, hey, the minerals in the soil are tanking. Mm-hmm. And this is a gigantic problem. We need to fix this. They didn't do anything about it.
And that was 90 years ago.
Why didn't they do anything about it? Because if there's minerals in the soil, then people are going to be healthy and they're not going to get sick and they're not going to need drugs. And Big Pharma runs Washington. It's nuts. Now, to make matters worse, there are a few minerals in the soil. Otherwise, the plant wouldn't be able to grow.
Right.
But when you spray the plants, with herbicides, especially glyphosate, Roundup, those chemicals, gravity, you've heard of gravity, right? The chemicals leach down into the soil. And they kill the bacteria in the soil, which help the plants absorb the minerals. So the more farmers use glyphosate, which they use every day, every way, all the time, in and out, upside down, all around, the less minerals are in the food. So we're screwed. You could own 100 acres of the most organic farmland on planet Earth, only eat what you grew, and you would still be deficient in minerals because they're just not there in the soil. They're not. It's mandatory that you supplement with them. It's mandatory that you drink water, mandatory that you breathe air, mandatory that you take the 90 essential nutrients because they're not all in your food.
And speaking of food, you have also mentioned there are types of food that can adversely affect your health and your wellness as well as your immune system. And in fact, you've done a video that we have available for free at the top of OperationFreedomHealth.com called The 12 Bad Foods. And Pete, you were pushing that and talking about that in January 2020 as one of the things you need to do as the foundation for maintaining your health and wellness with this advent of this pathogen at the time. So 12 Bad Foods, you mentioned the foundation pack, the 90 essential nutrients and minerals. Full disclosure, more information on those products is available at OperationFreedomHealth.com. If you so wish to purchase, they're there as well. Purchase of those products does benefit this platform so we can keep doing this series. Now, the other entity we talked about in January 2020 was the fact that many people infect themselves with whatever pathogen it is through their own hands. Hands in their eyes, eyes in their nose, hands in their mouth, right? And we spoke about a benefit of sanitizers. But I have to say, I go back in time, and you mentioned the fact that, wait a minute, if you're going to use alcohol-based sanitizers,
yeah.
Well, if you think that that's going to give you any long-lasting protection, not so. Not all hand sanitizers are the same, even though we tend to hear about that being the case. Educate our listeners, because one of the issues that one of the entities we've talked about are these MyShield products that use a different type of technology. Educate our listeners on this hand sanitizer issue, because this is really important.
Well, it's a big deal. I mean, everybody puts locks on their doors, but nobody thinks about, to keep people who you don't want in the house, keep them out of the house. But people don't do that when it comes to germs because nobody's educated himself about how to do it. It's simple. So over 80% of the vector that pathogens get into the body is through the hands. 80%. It's called touch point cross-contamination. So, you sneeze into your hands, now the bug's on your hand, you touch a doorknob, you touch an escalator rail, you touch a handle, you touch a counter, you touch something, and now the bug's there. Then somebody else comes along, touches that something, now the bug's on their hand, and, they got something in their eye, so they do this, or they rub their nose, or they try to pick something out of their teeth after lunch, and now guess what? The pathogen's in their body. 80% of transmission of pathogens is through your hands. So this would perhaps be a prudent thing to deal with, especially in times of, pandemics, for goodness sakes. So the way that hand sanitizers work, and like the vast majority of hand sanitizers on the market, are alcohol-based. And they're alcohol-based because the intention of the alcohol is to kill the bug. Right? It's to destroy the bug through a mechanical action. But I don't know if you've ever noticed this, but for instance, when you spray Windex on your windshield to clean it, or, a glass surface, it's got a lot of alcohol in it, you rub it off, and I did this just the other day in my car. It was a sunny day. My windshield was all streaked. I put some glass cleaner on it, 75% alcohol. I rubbed it off, sprayed it on, and I could watch it evaporate. In like 15 seconds, it was gone. It wasn't there anymore. Alcohol evaporates like nobody's business. So you put an alcohol-based sanitizer on your hands. What's good for maybe, 30 seconds? If you're lucky. Oh, then you got to use more. Oh, then you got to use more. Oh, then you got to use more. Well, it's good for the, Procter & Gamble, right? The people selling the stuff.
Right.
But then what happens? Well, there's so much alcohol on it dries your skin out. Then your skin starts to crack.
Yep. More vulnerable.
And now you're more vulnerable.
Pathogens can get through those cracks.
So it's a stupid way to do it. I mean, you gotta have a barrier on your hands, but alcohol-based sanitizers are just stupid. I mean, it's like trying to light a fire with wet wood. It's just a stupid idea. So what's a better idea? Well, a better idea is to use a product that delivers a barrier which lasts for, maybe 24 hours. Is that a good number? It's a pretty good number. And that's what the stuff in the MyShield foaming hand sanitizer does. One application lasts for at least 24 hours. And this is really interesting how this stuff works. It's really interesting. So microorganisms, everything in the world has an electronic charge. It's either more positive or more negative. And the electronic charge of microorganisms, if memory serves, is negative. And the electronic charge of the hand sanitizer, the MyShield foaming hand sanitizer, is positive. So you put the stuff on your hands, and if there's a bug on your hand, it will be attracted to the chemical in the hand sanitizer by virtue of its electrical charge. And then when the bug sticks to the active ingredient in the hand sanitizer, the electrical charge of the ingredient in the hand sanitizer overwhelms the cell membrane of the bug, and it ruptures, and the bug is dead. So it's, you know what it's like? It's like those, those bug lights.
Yeah, right. The bug zappers. Yeah.
Yeah. So the light is a particular color to attract the bug.
Right. And here it comes. Zip.
Here it comes. Like a moth to the flame, and then zap. It's the same with this. It's non-alcohol based. It lasts for 24 hours. It provides a really nice nano shield on your hand. And I don't know whose idea this was, but it was a good one. They added aloe vera to it as a moisturizer. Because you're going to be using this on your hands, you might as well give your hands a little extra moisture. So it's really just a grand slam home run, this stuff. And it's very important. And what I've always recommended my patients do, especially in, cold and flu season, is those things you can put on your wall that hold the fire extinguishers?
Yeah.
Well, you get something like that, and you get a big bottle of the hand sanitizer, and you put it right on the wall in the garage door or the door where the kids come home. And before they open the door, they put the stuff on their hands before they come into your house. You keep a bottle of it at your house at Christmas time, at the holiday times. Anybody who comes in to visit you for the holidays, a little squirt on your hands, please. There we go. Like some people have to take their shoes off before they come into somebody's house. It's the same idea.
Well, and with this, they have the bigger bottle, and then they have the smaller bottle, right? So what we do is we have a bigger one in our house, in a number of locations, right? We have one in the bathroom, we have one in the kitchen, we have one near the front door, we have one near the back door, but we have the little ones, and we put in our pockets, our coat pockets. Right? Because what I found in looking through this, you get long-lasting protection, as you say, but at least on your hands, a minimum. The MyShield people will tell you is 4 hours minimum on your hands, and then with their disinfectants, it's like 28 days on surfaces. It's like 28 days. No, I mean that. And here's the thing about this, and this is why I think this product line is so important. Because they've done huge amounts of testing. You mentioned the foundation pack before, right? That foundation pack has, Pete, you've said this before, but it bears repeating, millions of dollars worth of research behind it. And the person that Dr. Joel Wallach, that did the research on it, the book that he wrote is in the Smithsonian, right? Well, the same is true with this hand sanitizer. This company, this MyShield company, what they did is they got it tested through the FDA and the EPA. And it's a minimum of 4 hours on your hands, for protection, and the disinfect 28 days on surfaces. Well, but it has the testing behind it. You see, and it's not just that, as you mentioned, when you put it on your hands. Like I have it on my hands now. There's like a powdery feel you feel to it. There's like it's not like a chapped, dry feeling you get from the alcohol based, right? But there's a lot of testing behind this that has been peer reviewed and published, which I believe is so very important. And those studies show on your hands you get at least 4 hours of protection, and then with the disinfectants on surfaces, like up to 28 days.
You know, it's really interesting, and this information is never going to make it into the mainstream.
Oh, no.
Because, again, it sounds like an old, worn-out saying, but it's true, and it's tragic, and something needs to happen here desperately, but it is not in the interests of the pharmaceutical industry to keep people healthy.
No.
You know, I read a story, or it wasn't a story, it was a research thing that somebody did a couple of years ago, and copper is another thing that kills pathogens. The metal copper. Just a pathogen lands on copper and it's destroyed. And they did an estimate that if all of the surfaces in hospitals were replaced from, stainless steel or aluminum or sheet metal with copper, that within 2 years, within 1 year, the hospital would make all of the money back that it spent on retrofitting all of its surfaces with copper from the costs of having to deal with secondary infections and really bad infections. It was like a win-win for everybody. But do you think they did it?
No.
Imagine
if they just did it with doorknobs.
Yeah, exactly.
Right? Let's just say, we don't want to do the counters. Okay, let's just do doorknobs. Right?
This is why this information platform is so important, because you're not gonna hear this on the mainstream. You just aren't. And that's a conversation for a whole nother time as to why and who's really pulling the strings behind the curtains. But it's not going to happen. And ladies and gentlemen, if you're waiting for the federal government to all of a sudden mandate a free medical market, it's not going to happen.
Nope.
So you must educate yourself. You must do it. You have to do it. It could save your life, for goodness sakes. A simple thing.
Yeah.
Like, putting hand sanitizer on it. 80% reduction in transmission of pathogens. I mean, that beats a poke in the eye with a sharp stick.
Yeah, before I go to the grocery store. Right? And I don't put this on. I don't put a hazmat suit on. Right? Pete. In my coat pocket. Zip. It dries quick.
Gotta love it.
I'm there. Okay?
Gotta love it.
Meanwhile, I go in that same grocery store. This happened the other day. And there's this guy, to this point, wearing 2 of these. Okay? He's looking at apples. He's picking up. Each looking at them. Putting it back. All right? Okay. Now, one falls on the ground. He picks it up and he puts it back in the display. And I say to him, I said, so you're wearing two masks? Uh-huh. You're doing that to protect yourself? Is that why you're doing it? Yeah. Okay. What about that apple you just dropped and put back on the display? Do you see the hypocrisy of this? What do you mean? I said, I'll tell you what. I got some really good stuff on my hands. Let me I had a disinfectant wipe, by the way, with this stuff on it. I said, let me just clean this up here. Give me that apple that you were dribbling across the ground. Give me that. Put it on there. And I then put the apple in my cart and I said, I'll buy it. But this is where we are in this day and age, Pete.
And nobody's smarter than a 5th grader, Dave. I mean, when you were doing orthopedic surgery, was it you or the patient that wore the mask?
It was me.
It was you.
Right.
Because let us not forget that the intention of the mask is to protect the environment from you, not you from the environment. So the only people that should be wearing a mask are people that think or know that they're sick, and those people shouldn't be out in public anyway. But everybody's lost that little data point over the last 2.5 years because nobody's smarter than a fifth grader.
And we wear masks in the OR. We did because as you're talking, in case there's a droplet of something, at least the mask would potentially prevent as a barrier for something like that. But I mean, this is, again, things have become so bass-ackward over the past 2 years that and it's actually harmed people. It's actually harmed people, Pete.
It has. Oh, it's killed people.
It has. So those MyShield products that people say, well, where do I get this? Okay, they're on the homepage with more information about them as well on OperationFreedomHealth.com. On the homepage, right, as you go down, there's a MyShield information and the products, and also the foundation pack, and also the free video that Pete did on the 12 bad foods. You know, Pete, go back to that video we did over 2 years ago in January 2020. And what we just talked about now, is there anything different as far as our recommendations from then to now?
No. And see, this is one of the beauties of what we do, because when you have a scientific methodology based on natural law, then you only add things to it. You never subtract. But when you have a medical methodology based on somebody's bright idea, it always fails. And, you know, the halls of conventional medicine are littered with the discarded remains of outdated, ridiculous theories. You know, bloodletting, and high doses of mercury. That's a good idea.
Smoking.
Yeah.
Thalidomide.
So we add, and what we've added in this case, because we weren't aware of this product before, was this product. Because you're right, that not all hand sanitizers, not all nutritional supplements, not all bottles of wine, not all bowls of chicken soup are the same. And the details matter. This is a flippin' fantastic product, and everybody should get it and use it, because 80%, I mean, that's a big number. So you can eliminate your chances of getting sick from a pathogen by 80% by putting this stuff on your hands. And, you know, why wouldn't you do that?
And here's the thing, Pete. We talk about barriers, right, with this. There are no barriers to entry with these products. You don't need a prescription. You don't need to go to see the doctor. You don't need to have an insurance company. You don't need to get pre-approved from your insurance company for any of this stuff, right? But that's a big thing, Pete.
It is.
It is a big thing. But what does it take? It takes people to go to the website. It takes people to do their research outside of the website, whatever they want to do, and then they have to get it and use it.
And, you know, that's the only reason, honestly, Dave, that my profession still exists in the face of all of this big time pharmaceutical propaganda power and deplatforming, is because it works.
Right.
And the proof of the pudding's in the eating, for goodness sakes. But there is one thing that this will not fix. This will not fix the desire to vote for Democrats. If you are infected with that illness, then that's incurable, ladies and gentlemen. I'm sorry.
Or globalists.
Or even better.
There's a lot, right? There's a lot of globalists that have an R after their name, and a lot of globalists that have this is sad. The vast majority of people in politics at all levels are globalists.
It doesn't really matter what their affiliation is anymore.
No, it really doesn't. And that's the sad part, right? That's the sad part. That we think at times we're voting for change when the new boss is the same as the old boss.
Yeah.
right? Okay, and all the bosses are not really bosses; they're puppets of a bigger syndicate that includes big pharma and big medicine and big insurance and big banking and big government and the like. And this is why this series and this platform is so despised by all of those members of that syndicate. Because it's about individual empowerment. Individual empowerment.
From God's lips to your ears, Dave.
Pete, educate our listeners on how they can follow you and how they can get more information on your books and your information.
Just go to Operation Freedom Health, for goodness sake. There's a link there for my website. My website, Rise Up Into Health. Operation Freedom Health, we have the Cliff Notes about health recovery stuff. Mm-hmm. At my website, I've got the full course, Rise Up Into Health. If you want to extricate yourself, if you want to leave Big Pharma behind once and for all, if you want to learn how to make your body healthy, learn how to support and promote your body's built-in, God-given ability to fix itself, then I've got your back. Go to my website, riseupintohealth.com, become a subscriber, and let me introduce you to the undiscovered country of science-based, clinically verified, licensed, and regulated naturopathic medicine. You have no idea what you're missing.
And the books, Everybody is Sick and I Know Why, An Attempt to Cure with Holistic Medicine, available at drglidden.com as well as Amazon. Pete, I'd like to thank you for everything you have done, are doing, and will do. And I'd like to thank you folks for joining us today. Until next time, Dave Janda signing off. Dream big and dare to fail. Thanks for your time today.